Good afternoon. My name is Christopher Olin. I work for August Community Catch Program. I want to have a conversation regarding crystal meth, MSM, and HIV. The objective of this information is identifying reasons why MSM uses crystal meth, identify reasons why crystal meth use is so common among the MSM community, and crystal meth routes of administration, meaning how they tend to use the drug, which administrating the drug into the body. Okay. Uh, I just want to talk about MSM. How does MSM label themselves? They basically label themselves themselves as several ways: being gay, bisexual, heterosexual, pansexual, questioning, queer, same-sex loving, homosexual, curious, bi-curious, and being straight. That's that's some of the ways that MSM identify themselves. Just not just seeing MSM meaning men who have sex with males, and that's the meaning of the acronym MSM. So reason of using crystal meth would actually, be to fit in, you know, it increases self-esteem, the drug, crystal meth. It increases libido, so they can have the sexual contact with another individual. Basically, it's a club drug, and it prolongs sexual performance and enhances the sex act. Like I was saying, so route of administration from the drug is basically um, they swallow the drug, which one of the quickest way. Snorting the drug, meaning they take a straw and they put it up their nose and they inhale it. Smoking the drug, they'll either use a glass pipe, aluminum foil, and heat it up so they can it melts and the vapor that's how they'll smoke it. Injecting the drug, meaning through needle, they melt it down and they'll put it in their vein. It's one of the quickest way of getting the drug into the system. And another quick way is booty bumping. So booty bumping is just one of the way that the injectable, but they'll take the needle out and booty meaning your 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 butt. They'll take the needle, the point needle off. They put the drug in. They go far up into the rectum, and then they shoot the drug in. So again, that's one of the quickest way of using the crystal meth drug. I want to talk about what's the long-term effect regarding MSM, well, male who have sex with male, effect, because of their use the drug crystal meth. Anxiety, one, tooth decay, meaning that the bone tissues that's holding up the tooth is rotten and makes your tooth fall out. The teeth falls out, reduces speed. So it's a sexual difficulties, meaning crystal meth, meaning you can't get hard, you can't get an erector. How you say it? Reduces motor skills. I said it, and insomnia, insomnia. Wow, I can't I guess you cannot sleep. Sorry, I can't. For some reason, I have issues with the syllables. Yeah, long. Like for some reason I do. Recognizing the system of crystal meth use is the sign of abuse. Is a rapid loss weight. I mean weight loss. You know, a nervous energy. You know, people like so nervous. You know, these of sleep. No need of sleep, meaning they stay up. They just stay up, you know, and then they just get high and stay up, you know. Aggressive talk or behavior. Mean temperament, you know, they're mean and they're angry, you know, especially when they're not have no drugs to use or no means of getting any. Compulsive, very compulsive, you know, and exceeded talk, like they just keep on and on, and they're talking on and on and on, you know. Signs of withdrawal of the drug is just a long crash. You know, they just crash. They fall out and they just crash out. You know, and just basically, you know. But it says ray of depression and fatigue and anxiety. You know, those are the suicide ideation. Those are like reasons how they are. You know, just basically signs of crashing or withdrawal. We talk about recovery from from crystal meth. You know, addiction is a long road, but it's not an impossible journey. You know, basically, you know, there are studies that confirming that the appropriate treatment of crystal meth addiction will varies from person to person. So everybody is different when it comes down to crystal meth and crystal meth use, and how people recovers from the drug. So that's how the studies are. You know. Generally speaking, the most common treatment approach usually involve in a combination of several treatment strategies. Detoxing from the drug is more than just physical act, you know. The mind also needs to be trained how to how to function without meth, without crystal meth. This is why treatment also needs to be addressed psychology, psychology damage that occurs as a result regarding crystal meth addiction. It's possible to recover functions and develop a flourishing life without the need of meth, you know, each day. But again, it's going to be hard. It's a long road, you know. So cognitive behavior therapy and intervention strategy are often highly successful treatment approach. Understanding the root of addiction and counseling for family members is also equally important. Current, currently, there are no approved medication to be used in the treatment of crystal meth addiction. However, promising resources has shown that there are certain drugs which might be helpful in the role of recovery. There's crystal meth and HIV, which is really difficult. You know, occasional use can cause weight loss and vitamin depletion, poor medication adherence, because basically somebody who's HIV positive and they are using drugs or crystal meth or cocaine, they're not going to adhere to their drug regimen. you know, the medication regimen for HIV, you know. It may impact everyday cognitive symptoms, includes important activities of daily living, meaning grocery shopping or planning social activities, even bathing, even getting dressed, or even going to work. You know, crystal meth has a lot of effect on people who are currently, I say it, addicted, and it's like we said, it's a slow road. So, I mean, it's a long road. Somebody can recover from the drug, but it's just having that strong ability to do so. Thank you.